Good evening. In this lecture, we will discuss anti-inflammatory drugs, classification, and synthesis of some selected anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs are used primarily to treat inflammation, mild to moderate pain, fever. Specific use include the treatment of headache, arthritis, sports injuries, and menstrual cramp. For example, aspirin is used to inhibit the clotting of blood and prevent stroke and heart attacks in individuals at high risk. Non-steroidal anti-inflammatory drugs are also included in many cold and allergic preparations. Non-steroidal anti-inflammatory drugs are associated with a number of side effects. The frequency of side effect varies according to the drug. The most common side effects are gastrointestinal tract disturbance such as nausea, diarrhea, constipation, vomiting, decreased appetite, and the peptic ulcer. Non-steroidal anti-inflammatory drugs may also cause fluid retention, leading to edema. The most serious side effects are kidney failure, liver failure, ulcer, and prolonged bleeding after an injury of surgery. Next is mechanism action of anti-inflammatory drugs. Anti-inflammatory drugs inhibit cyclooxygenase, the enzymes that catalyzes the synthesis of cyclic endoperoxide from the arachidonic acid to form prostaglandins. The two COX isoenzymes are COX-1 and COX-2. The function of COX-1 is to produce prostaglandins that are involved in normal cellular activity like protection of gastric mucosa, maintenance of kidney function, while COX-2 is responsible for the production of prostaglandin at the inflammation site. Most non-steroidal anti-inflammatory drugs inhibit the COX-1 and COX-2 with varying degree of selectivity. Selective COX-2 inhibitor may eliminate the side effect associated with non-steroidal anti-inflammatory drugs due to COX-1 inhibition, such as gastric and renal effect. So this is the general mechanism of action of anti-inflammatory drugs. Next is the classification of anti-inflammatory drugs. The anti-inflammatory drugs are classified as first salicylic acid derivatives, example aspirin, salicylate, sulfasalazine. Second, para-aminophenol derivatives, example paracetamol, phenacetin. Third, pyrazolidine dione derivatives, examples phenylbutazone, oxyphenabutazone, sulfenpyrazone. Next, anthranic acid derivatives, mefenamic acid, flufenamic acid, meclofenamate. Next, aryl alcoholic acid derivatives. Subpart, indole acetic acid, example indomethacin, indene acetic acid, sulidinac, pyrrole acetic acid, tolmatin. Next is phenyl acetic acid derivative, example ibuprofen, diclofenac, and naproxen. Next, oxycams derivatives, example piroxicam, meloxicam, tanoxicams. Next, selective COX-2 inhibitor, examples celecoxib, rofecoxib, validocoxib. And next is miscellaneous, examples phenylbutazone, phenazone, and nimesulide. So these are some examples of and classifications of anti-inflammatory drugs. Next is the synthesis of mefenamic acid. This is very important anti-inflammatory drugs. The mefenamic acid can be synthesized by the reaction between chlorobenzoic acid and dimethylbenzenamine. In the presence of copper bronze, the name of the reaction is Ullmann condensation, resulting in the synthesis of mefenamic acid. Medicinal uses: It is a non-steroidal anti-inflammatory agent with analgesic, anti-inflammatory, and antipyretic property. It is an inhibitor of cyclooxygenase. So this is the official synthesis of mefenamic acid. Next is synthesis of ibuprofen. The ibuprofen can be synthesized by when isobutyl benzene is treated with acetic anhydride, acetylation is carried out and resulting in the synthesis of para-isobutyl acetophenone. Further, in second step, para-isobutyl acetophenone is treated with hydrogen cyanide and which resulting in the synthesis of cyanohydrin derivative. Cyanohydrin derivative further treated with hydrogen iodide reduction carried out, resulting in the synthesis of desired drug ibuprofen. So this is the chemical reaction for the synthesis of ibuprofen. In examination, the synthesis of ibuprofen may be asked. This is very important synthesis. Properties: ibuprofen is a white crystalline powder or colorless crystal, practically insoluble in water and soluble in acetone, methanol, methylene chloride, and dilute solution of alkali hydroxide and carbonates. Medicinal uses: it is an anti-inflammatory drug that possesses antipyretic and analgesic action and is used for the treatment of rheumatoid arthritis and osteoarthritis. Thank you.